Today our guest is someone who I really enjoy working with, Courtney Frost. And Courtney Frost is a program officer at the Blue Cross of Idaho Foundation. And she works on the High Five program, which is initiative for eliminating childhood obesity. So she's working to make real transformational changes in communities. And Courtney's here today to talk about her Mayor's Walking Challenge, which is happening this year. So Courtney, I'm going to go ahead and let you just get started and take it away.
Okay, I am going to say the most annoying words of 2020. Can you all hear me? Yes, okay. I had to throw that in there. Okay. And can you see my screen? Yes, okay. So unfortunately, I have not been able to join Silver Linings before. So like Cynthia said, please use the chat if you can. I'm a huge advocate, and I love the reaction tabs of the thumbs up, the clap, do all that so we know that we're vibing together a little bit during the presentation. Today, I'd like to talk to you a little bit about the foundation, its work, High Five, the initiative that I oversee, as well as the upcoming Mayor's Walking Challenge. Let's go on. All right. So Blue Cross of Idaho Foundation is a private nonprofit foundation dedicated to addressing the root causes of some of Idaho's most pressing health issues. One of the first things I get asked when I'm in communities is, so can you talk to me about my premium or my deductible or my what is covered? We are a separate entity from Blue Cross. And unfortunately, if you are joining the call to learn about your health insurance coverage, I am not your person to talk about that. I've heard we have a great customer service department at Blue Cross. We are a separate entity. We were founded in 2002. We have a separate board, goals, tax ID number. We really are a separate organization. We work a little bit differently as well. One thing that I am really impressed with our Sarah, shot, are you? I am the Fitbit person. I am the Fitbit person, absolutely. Thank you, Erin. Thank you. I am also the Fitbit person, yes. We are, as well as being the Fitbit person, I am the program officer over High Five, and I've been there for about 5.5 years, believe it or not. One thing I'm very proud of about the foundation is we are statewide. I don't mean the great state of Ada. I mean truly from Bonners Ferry to Malad to Driggs and everywhere in between. We have partnerships and programs statewide, and I'm really, really proud of that. We really focus on upstream solutions to some of those health issues and focusing on strategic partnerships as well. So what are our initiatives and focus areas as of right now? High Five, which is children's health, and I will be talking a little bit about that. Youth behavioral health, healthcare innovation with a focus on rural Idaho. So High Five, that is my initiative. Yes, and I am a first-time mom, so I'm obsessed with my kid as well. So this is my son, Sonny. I'm doing a little bit of healthy cooking-ish and getting physically active. And those are two main areas. Now I understand that there are a lot of things that come into play when we talk about children's health, but at the foundation, those two lanes are really where we're focused in. So we have a quiz to make sure that you are paying attention. Sarah, do you have that? Oh. So to make sure you're actually paying attention, because it's 2 o'clock on an afternoon, what are the two areas of High Five? Rural health, access to healthy, affordable foods, increased cookie consumption, and getting kids physically active. I'll give you 5 seconds to get that. 5, 4, 3, 2, 1.
Oh, those results are just rolling in. Okay.
Not, are they?
Last chance to get it in. Here we go. Ready. Okay. There you go. See how everybody did.
Guys, Good job. There are access to healthy foods and physical activity. So in our High Five initiative, those are our focus areas. So thank you for doing that. So about 4 years ago, we had a gut check. We thought, all right, we're statewide, we have a staff of 1 and a limited budget. Are we being as strategic as we can with our dollars, time, and energy? Where are we having successes and where are we kind of floundering? And we asked ourselves a couple of questions to really narrow down, because we were trying to be everything to everyone and we simply just could not do that. So one area that we looked at was social determinants of health. And everyone talks about this now. For us, it refers to the conditions in which people are born, grow, live, work, and age. And what has been really successful under the High Five initiative is that neighborhood and built environment area. So now we kind of understood where our sandbox is, where our area is. Now we had to really think about who can be our strategic partners, who can be our thought partners in this area, and what has been successful and what hasn't. And let's see, it's working with cities and local elected officials. Now, why do we do that? So we work with local elected officials like mayors because they understand their communities, obviously. I do not know how to raise a kid in Malad. I don't know what it's like to ride my bike to softball practice in Rathdrum, and I don't know what it's like to host a community event in Pierce. So really, those elected officials understand their communities. They're role models in their communities. They're community advocates. There is a reason why they put themselves out there to run for this role. They're nonpartisan. Don't have to explain the positives about that. They have existing relationships in communities. They understand local policies. They're able to convene a wide variety of people, and they are well-known change makers. Local elected officials in cities are in that role for a reason. Their communities voted them into office because they have faith in their community and they represent their community. We understood that working with them as a thought partner will help us understand Idaho more and help us adapt and learn and co-create together programs that will help kids become healthier through the backbone of a city and a local elected official. So with local elected officials, they are also able to help us with sustainable transformation. Those two words are like hot words in philanthropy. And so let me tell you what really it means for us. What it means is that, how many people in the show of thumbs, the reaction, how many people have worked with Mark Fenton? Reactions, yes, okay, see one. Well, two. He has a 3 Ps approach. So when he does a community dialogue, he goes back and he talks about programs, policies, and projects, okay? Well, we worked with Mark to adopt this model of sustainable transformation. And roll with me on this. Under High Five, we believe that if 4 Ps are rolling at the same time, succinctly, sustainable transformation can happen in communities. What that means is, yeah, you can have an amazing program. It could be awesome, well put together. But sometimes when it's just a program, sustainable transformation, no matter where your area or target audience is, it's a little bit harder to create that massive change, right? Now, what if you have a program that also has a partnership aligned with it? Now that partnership continues, even if maybe the program ends, if the funds end or if it's a different funding cycle. You create advocates. Then maybe you add in a tangible city project to that. So you have a program, a partnership, and a project that folks can rally around. And then all of those gears are turning, and then you layer that on with a thoughtful policy, whether it is a policy of walk bike ordinance or a comprehensive plan that really adopts that healthy mindset in our regard, or in our case. So we look at, in the foundation, how can we have sustainable transformation? And this 4P model has really worked with us. Working with the local elected officials has been beneficial for this transformation because they play a role in each P: program, policy, projects, and partnership. I know that's a lot. Let it marinate a little bit. So working with communities. Now that we know where our strengths are, and we have kind of doubled down on working with local elected officials and communities, and we have three big programs. Now, the outcomes of each of these programs are going to be different because, as we all know, there's not a one-size-fits-all approach when working with communities. It is not prescriptive, and that is not how you have a catalyzed change or transformation. So we have the Mayor's Walking Challenge, which I'll get to. The Community Health Academy, which is a learning collaborative that we invite 5 mayors and their city staff for a 6-month learning cohort. We learn about what is community health and what role they play in it. They then get a grant so they can pilot a project in their communities that have to do with community health. And then the Community Transformation Grant. That's probably what we're most known for. And it is our 3-year, $250,000 plus technical assistance grants. Orofino and Twin Falls are currently in year 2 of their Community Transformation Grant. So right now I'm going to stop and pause. That was a lot of high level stuff. Does anyone have any questions for me about our programs or any of the 3 programs we highlighted? No. Chat box works well. Or you can just give me, Erin, Bennett, if you feel good, just give me a thumbs up. I'm just looking at you.
I feel good.
Feel good. Amanda, you're feeling good?
I just add the community transformation grants so that you guys have gone away from like the one-off grants to different projects and programs, and you're looking for more long-term systematic changes that incorporate all those things that you were talking about versus, you know, I think a lot of us have seen those different grants that one place will get a $5,000 grant and another place gets $25,000, and it doesn't really add up to anything major until it's all put together in the community transformation grants.
Yeah, that's true. And we also, we do work on pilots, and we do try to have some other one-off programs, but those are our 3 main ones. Yeah. And Deanna, can you describe the Health Academy a bit more? Sure. So we took a pause in 2020 because 2020, and we would be going in on our 4th cohort. So what we would do is we would invite a mayor, usually 5 of them, to come along with city staff of their choice. We then contract with experts around what is community health. Mark Fenton usually comes in to that, and we meet 3 times in person. We then have 2 webinars where we learn about strengths. We actually do strengths finders. We learn about strengths of a city. We learn about community health, what that even means. Then walkability, and then we learn about access to healthy food with Ken Meter. I don't know if you all know him. And then we talk about pie in the sky. What can we do? Oh, what can we do? What can cities do? And then we give them grants to pilot those ideas in their communities.
Hey, Courtney, I have a question that came just to me, so I'd like to read this to you.
Yeah.
It's from Pat Richetti, and his question is, what are the 2 cities doing with their grants, and are each of them $250,000?
Great question. They're both $250,000 each. The Community Transformation Grant is 2 phases. So the first year is really phase 1, and that is learning and understanding. There are no grant dollars that are really issued out in phase one. It is all about community dialogues, community surveys, parent focus groups, kid focus groups, really understanding the secondary data that's around that process as a team and as the mayor and city. Then the second and third year of the grant focuses on implementation of the program. And right now, Orofino and Twin Falls are just getting into their understanding their community, and now they're getting into that implementation phase. They have not issued out any funds or grants from their programs yet. Any other questions? Great questions, thank you so much. Okay, so the Mayor's Walking Challenge, this is why we are all here, right? So the Mayor's Walking Challenge started in 2014 when Dave Beater wanted to walk 150 miles for Boise's 150th birthday. It has morphed and changed. The competition, the partners, the school input has changed throughout the years. But in the last 2 years, we have been the sole funder of it and decided to make it statewide, solely focused on elected officials. Poll, again, keeping you on your toes. When was the first Mayor's Walking Challenge? I should have had like the Jeopardy soundtrack on my phone. I don't. All right, give it a little bit more. 5, 4, 3, 2, 1, go. Oh, 2014, okay. So 2014 was the first one, and it has morphed and changed. So what is it? What is the Mayor's Walking Challenge? It is as simple as it sounds. In October, we challenge all local elected officials, or all mayors, excuse me, all mayors to join us in a walking challenge. Every single one of them, every single one of them receives a Fitbit. We even program it. And then their goal is to walk an average of 10,000 steps a day. In the past, they've had bonus steps of walking with groups of community members or children or schools. And if you hit that 10,000 steps, then you get a award of $1,000 to use in your community how you see fit on either access to healthy foods or physical activity improvements. It's really as simple as that. That's why I think that I'm such an advocate for this program, because I actually don't see a negative about this program. Worst case scenario, you're getting active and healthy. Dang, that sounds like a good worst case scenario to me. We really have seen very, very interesting outcomes of the Mayor's Walking Challenge. Right here, this is the mayor shown walking with kiddos in his community. He has won every year he's participated. We've also had some really interesting feedback. And the goal of the Mayor's Walking Challenge for us is to get mayors in a healthy role model role for their communities so that kiddos and community members see them walking. They also can start piloting some innovative projects from the city that maybe they didn't have those additional funds to do in the past. For us, we really understand that we learn a lot from mayors when they walk through their communities. The mayor of Homedale, who I don't think is here, Eric Christopherson, who I think is a wonderful human, he shared with me that he has lived in Homedale his whole life. But it wasn't until he was forced to get out and walk every street of Homedale that he really understood every neighborhood in Homedale. He had conversations with people that he had never met before. Folks that had never known about their mayor started talking to the mayor. A lot of people tried to pick him up, like, you know, they were in their car and said, like, what are you doing out walking? You need to get in my car. But he said, no, I'm walking. And now he walks to his business and then walks from his business to City Hall. In the past, he would get in and take a 5-minute drive. And now he's a walk advocate. because of this program really getting and pushing him out to actually learn about their community. In the past, some Magic Valley mayors have said the same thing. Oh, I thought our trail system was awesome until I walked it every day and I saw huge gaps that need to be improved. I've seen where we need to actually locate benches or garbage cans because I have seen where people are struggling or where the garbage has dropped off at. So it's been really, really interesting and thoughtful. And yes, this is how I became the Fitbit girl, because most people thought I was the Fitbit. I know that I'm an employee of Blue Cross of Idaho, but some mayors called me the Fitbit help girl. That's fine. I can do that. I'll answer to that as well. Examples of funded projects are as follows. Just like we all know, every single community is different, every single person is different, and every single funded project is different from this grant. Some communities like Twin Falls and Caldwell matched it with city funds to make a larger impact, which was interesting. My favorite funded project was the Frog Spring. In Kamei, they have an old school play structure where it is a frog and it is on a big spring. You get on it and it kind of rocks back and forth. You know what I'm talking about? Those old school play structures. Yeah, well, the spring went flat and they never had the money in their parks department to upgrade that dang spring. And by golly, they used their Mayor's Walking Challenge to get that frog a new spring. And that was the most unique project that I have heard of this grant. And seeing the funded projects also helps us as a funder understand and have a dialogue with our participants of what they see in their community. If they had more money, what would they do? What is a way to match these funds with something else to make a bigger impact? After every single walking competition, we have a post-event survey, and we ask hopefully they're very honest with us. Each participant, if they won, if they didn't win funds, what was the best part about this challenge? Give me the good, the bad, the ugly, the improvements, what you hated. And every single one of them said, every single participant in the past said it's about community. People loved engaging with community members that typically they would not engage with because they would be either in an office or on a meeting or walking or driving, excuse me. It was all about learning more about their communities, engaging stronger relationships with community members through this program. It never was, my favorite part about this program was the $1,000. It was all about engaging with their communities, becoming healthy role models for kiddos in their community. And I thought that was really fascinating every time I got that insight. So another quiz time. Since the challenge went statewide, how many mayors have participated in the Mayor's Walking Challenge? 40, 39, 91, 81. Feel good? Okay. All right, and close.
Oh, this one's really split.
Okay, let's see it. 39 and 81. Well, that 44% got it right. 81 mayors. 81 mayors. I mean, I believe we have 201 incorporated cities in Idaho. So I would love to get 50% sometime. Gosh darn. That's what I would love. But I will take 81. I will take 81 mayors. And since we have been statewide, so since 2018, we have issued out $130,000 towards these programs through the Mayor's Walking Challenge, which I think is pretty cool. I'm excited about that. So the 2020 Mayor's Walking Challenge, what does this look like? 2020 looks a lot different from everyone than we thought, correct? I have taken the past several weeks to call up some of our past participants to understand what life looks like as a mayor right now. And we have learned that they are busier. Mayors and local elected officials are busier than ever in a obviously pandemic. So, and every single one of them wanted to continue this program. So we decided that the daily step goal has been reduced because we understand that the meetings are about 4 times as much as the meetings were last year. There will be no bonus steps this year for walking with groups of students or groups of citizens. That this is going to be a very individual activity this year. And mayors are able to use their winnings for COVID relief funds in their community if they choose, or they're able to use it to encourage citizens to get physically active. So we're really trying to make sure that we understand times are hard. We understand that this is incredibly uncharted territory that we are in. And so how we can best adapt this program to meet communities' needs and being thoughtful was huge this year for us. So registration begins September 1st. Does anyone, I think we have a couple of folks on here who I know their mayors participate. But I guess my end is going to be, I hope you all encourage your local elected officials to participate in a thoughtful, meaningful way. If there is any questions you have for High Five or the Mayor's Walking Challenge, I am all ears.
Thanks, Courtney. So let's open it up for questions. Is there anybody who'd like to ask Courtney a question about her programs?
Hey, Courtney, this is Mayor Froelich, Victor, Idaho. Appreciate you running through that deck. I'm newly elected, so it's my first time doing it. I look forward to forcing myself to get out more during these times for sure. Being first to it, I assume registration, you get us the information, we fill it out, and it's as easy as that. Is there anything we need to do from now until then, or is that on your guys' shoulders?
Nope. You will be you will be seeing registration information come to you either the day before or September 1st. And then we will issue you a Fitbit program that sucker for you, and it is off to the races.
All right.
Thank you for participating. That's going to be awesome.
For sure. Thank you.
Yeah.
Courtney, how many mayors do you have so far signed up for this year?
Well, we have not opened registration quite yet. So the answer is 0.
Okay. How many do you think you'll get then?
Oh gosh. I would love, understanding we're in such crazy times right now. I would love to see us get 60 mayors this year. I would love that.
I'm raising my hand.
Sarah?
I have 2 questions. So you said you lowered the step count. I'm curious what you lowered the step count to, the number. And then second question, I saw you look to Erin Bennett a couple of times and she jumped in and shared a couple of times. So I'd love to hear, is that a partnership that you have for this program?
Great. We have lowered the step count to 5,000 steps a day. So that is about 2.5 miles a day. But just understanding, actually a couple of mayors I spoke to actually read through their calendar in one day, and I thought, oh goodness gracious, that's a lot. So I wanted to really do that. And I looked at Erin Bennett. Erin and I used to work together at the American Heart Association. I have leaned on her for some information about safe routes to schools in the past. Through the Mayor's Walking Challenge, we'd like to send out some education or information in our weekly emails during the month of October. And Erin has been a really great partner of giving us some information, some healthy tidbits to share with communities through those email chains.
So I have a question. I know that you have had a mayor in the past, Mayor Petrie, who has been really, really involved. And I wondered if you could share a story about somebody who's become an incredibly avid walker. and I think partly because of your program, right?
Yeah. So Mayor Petrie is one heck of a guy. I will fast forward and say rewind about 3 years ago, the walking challenge was a walking competition. So there was first place, second place, and then nothing. Okay. And who would have thought that elected officials were a little bit competitive? Who would have thought? Who? And holy smokes, we had people walk in at 4 a.m. to 10 p.m. We had people having foot issues because of this, and it was all because of Mayor Gordon Petrie, who was very determined to be number one each time. And so he was he was incredibly active and sorry, I only giggle because he just went all out for that. I think to talk to you a little bit about some more, the mayor of Kamei, she also realized that there is a way to get more active throughout the day. She is on her feet the majority of the day anyway, and thought, wow, I'm almost getting 10,000 steps. And this challenge pushed her to hit that 10,000 step goal. She was always averaging around 8 or 9. Now she always hits 10,000 steps a day. I think the mayor of Grace has implemented walking in her everyday life. She's always in the mountains or in God's country, as she says. And it's beautiful. She has an amazing scenery to work with. And so this really helped her see how much she actually walks during the day. And it's pretty impressive. I think that it is very interesting to have walking meetings. I know that Sarah put that up there. A unintended consequence is some of these mayors made, some of our past participants have made city walking meetings for their city staff. And I once got an email from the city staff member saying, I hate this program because we're walking too much during the day. It is so tiring. So maybe it's helping internal processes as well. Yeah, it's exciting to do walking meetings. I think it's exciting. The city of Homedale actually has purchased, for the past 3 years, purchased Fitbits for all city employees, and they have continuous walking challenges throughout the year based on this program as well. So anything that helps, if we can get folks walking a little bit more during the day and start creating that splash and ripple effect of all of a sudden it's just one person, then it's a city staff member, and maybe the city staff members go back and walk with their families. That's huge for us.
And if I can pipe in here, I'll just say this is the part where Courtney and I connect a lot, because the mayors she's working with are the ones that I then I rely on to have conversations with their legislators, so that when we're talking about the bigger statewide efforts to improve walking and biking in the state, those mayors are our advocates, and they have a whole lot more influence than a number of us or different organizations that don't necessarily have that backing of, I'm the mayor, I'm in the community, and I've done this, and I see what's going on, and this is what we need, and this is the policy that should be passed to help support that. So that's been very helpful, and I think with Cynthia and the Walk Bike Alliance group, we've done a good deal of progress in the way people think in this state when it comes to active transportation over the last several years.
So I'd like to add something to that, Erin. Thank you. You know, Deanna and I, with Vitruvian Planning, just did a really great temporary traffic calming demonstration in the town of Emmett. I can pretty much guarantee that that would not have happened if Mayor Petrie had not participated in the Mayor's Walking Challenge. It just changed the perspective. So, you know, I really would like to encourage everybody to talk to your elected officials and your mayors. And I'm going to read Aaron Bacon's question here. Would you recommend that we reach out to our mayors and encourage them to participate? Yes. How do the mayors hear about the challenge? Courtney?
Absolutely. So the mayor is here about that. We have partnered up with the Association of Idaho Cities, and they will be they traditionally help us with communication. And so every mayor and every city clerk should be receiving information quite regularly starting September. That we also will have starting September 1st on our website. We will have a registration link as well. I will send that to Cynthia, and if you guys need, she can either send it out or be a resource for you as well.
Thanks. Courtney. Any other questions?
Okay, I feel good about this.
That was great. Looks like you're getting lots of applause, Courtney. Good job.
I don't know if I'm getting it. Would add Cynthia. Cool.
The chief of police. Yeah, that's a good point, Deanna. That's a really good point. The chief of police in Emmett was instrumental in that project, wasn't he? And he was out there all the time. He had his kids out there helping to paint the crosswalks and stuff. I mean, politics are truly grassroots, right? I mean, you got to start locally. And so, Deanna, have you heard any more on the Emmett project? If they're going to take it a step further to look at something a little more permanent, do you know?
Right now, probably not. First of all, not surprising, the community was lukewarm. Samantha can probably attest to this a little bit. She came and did we went out and did some intercept surveying and talking to people during their big car show in July, which was interesting since Samantha and I were some of the few wearing masks. They're feeling very positive about it, only because, and this is one of the strengths, I think, of these demonstration projects, is it really helped bring more people to the conversation and more people to the table. Talking about this stuff isn't nearly, and I'm sure you guys experience this with High Five. We've come into some of the High Fives behind you guys with some of our work, and they're just so much more ready. And I think some of it is because you've done the Health Academy, you've done all these things. And so you've anything that can kind of prime the pump and get people talking about it. But what I loved about the police chief's role out there is especially in these small communities, but I think across any community, they really see safety as their purview and their responsibility. And he's aware of their crash data. They did have some bad pedestrian crashes over the last few years, and it really hit the community hard. And so he's very invested, and also working with Elaine on trying to bring safe routes to school. They did get a successful TAP funding. And so part of the reason they're not going to be moving it forward soon is they're more focused on that. That's coming in a while. They might possibly do the mid-block crossing. And I suggested, we just met yesterday, and I suggested to him that one option, because they don't have money right now to go and fix this infrastructure tomorrow. And I suggested to him that if they really want to play around with the mid-block crossing longer, they could just install a more permanent temporary pilot project and just kind of use their own, ours was straw bales and chalk, and the police chief really liked that idea, and I think he's going to explore it with the mayor. So it's huge.
And thank you, Deanna, for that. I also will say, I really love hearing about the momentum continuing, because I'll be honest, I am not, surprise, surprise, I am not an expert at walking and biking and multimodal transportation. I got my degree in communications. So I think it's really important that we come out and engage how we can, and then really rely on those experts in the field to then take on what tangible change they can make in each community. And whether that is with your group or however the community sees their partnership running with whenever, I think that's really exciting to hear that again, looking at that gears model, that everything is continuing to move forward with partnerships and projects.
So we've been asked to describe that traffic calming project in Emmett. I'm going to go ahead and show my screen so I can show you all a picture of a portion of it, which is the mid-block crossing that stayed up the longest. And then Deanna, feel free to explain this if you'd like. Can everybody see that picture?
Oh, I love that.
I think two of those kids were the police chief's daughters, and then their friend and the mascot. I forget what the mascot is, a tiger or something?
No, they're Huskies.
The Huskies. Okay, so those are Husky Paws, right? And this is the mid-block crossing. So this is the part that stayed. As for those of you who've been to Emmett, that's a big city park across the street. And then behind us is the county courthouse, I think. And
City Hall and County Courthouse.
thank you. And so this is the section that ended up staying, and it narrowed the crossing. It brought a lot more visibility to that crossing, so it improved safety for pedestrians. And it also engaged the community. These kids came out and helped, and they had a really good time. So it was a fun project to be a part of. Anybody else have a question for Courtney while we've got her? Jim Hansen, go ahead.
Oh, well, this is a wonky thing to do, but you know, the project is great, and since it is the seed for changing policy, being prepared when you help educate the mayors and other elected officials about how do road engineers decide how to spend money and what do they measure. And the thing I've discovered is that it starts with ITD. It exists in the biggest local transportation district here in Ada County, and it probably is the same in many cities. They simply don't use metrics to measure safety for walking, for pedestrians. And yet there is software, there are tools there that can be used so that when you say, oh, look, we got congestion, we need to bring the level of service for cars down in the future from F to C or to D. They don't measure that in the process, they might actually be creating worse level of service for walking because they don't measure it. So I think one of the things I hope you do is to ask and insist that those local elected officials require that we measure level of service for pedestrians. And it sounds wonky, but just write it down and ask, because the tools are there. And it just requires you to push a little harder and to do it. And believe me, it requires you to push, but just persist, keep doing it. The more we do it, the easier it'll be. Thanks.
Jim, thank you so much.
Christine?
I'm not sure if you've included the president of Boise State, but she is an avid runner, Dr. Trump. And this would be something that she'd probably be really into. She's kind of the mayor of our little town of 30,000 people on campus. So, and on a side note, we need a superhero outfit for Miss Fitbit or something. Seriously.
Yes.
Wonder Woman.
Yes.
That's great. Thank you so much.
I love that. Thank you.
Mm-hmm.
And Deanna, great thought. Thank you so much. Jim, I will also be following up with you after this meeting if I can. But yeah.
Courtney,
can, but Cynthia knows
another
what I'm talking
suggestion
about.
I'd make
be
on
even
top
better.
on top of the ASHD commission, which is kind of unique here, but you know, you said you want to get to 50% or more of the cities, which I think is a great goal. And you know, it may not always be the mayor that's the champion. Well, I think the mayor is the ideal starting point. There's some really good city council members out there. And if you have cities where the mayor is, you know, not taking the bite for whatever reason, maybe reach out to the council members. You know, Association of Idaho Cities could certainly help you reach all of them and find all of them.
Thank you for that. I also think that there is an opportunity for city managers or city administrators as well, because it was something that we need to look at. We do still have some time to look at, because I know mayors turnover and sometimes that staff member continues on sometimes. And so that's a great thought. Thank you so much.
Just know not all cities have that structure. We don't have the same structure throughout our state for cities. Because we're Idaho.
Well, that's just great. And, you know, I'd like to just echo what Erin said earlier, because she and I and Courtney all work up, well, not Courtney as much, Erin and I work at the Capitol, and we notice when legislators are more aware of walkability, they're way more inclined to help support our initiatives, which are statewide, which are trying to get dedicated funding for walking and biking. And we can't do it only at the Capitol, the state level. We have to be engaging people in the local level, and then they continue to push their legislators, and that's what helps us with our work. So it really is, it's all related. And oh, good idea, Deanna, and maybe the Idaho Transportation Board, Courtney. That is a good idea too. I love that. Excellent. So I think we'll wrap up unless anybody has any final thoughts or questions. Please share. Great job today, Courtney. Wow, you got lots of applause. Well done. Before we turn off, I want everybody to turn your video on. Let's just do a quick check-in, make sure everybody's doing okay. And thanks for joining us today, everybody. I think this was really, really great.